students become fixated on lecture handouts, in my experience, which mainly comes from the medicine background, but may well be true of other faculties in the college, where they want a piece of paper to take away with them from the lecture, a sort of portable lecture. And I think that's in some ways a little bit limited in how you can use handouts. The other way which I have used handouts is in a way that stimulates the students to engage with the material during the course of the lecture. So for example, if I have a complex diagram, then what I'll often do is to leave off the labels from the diagram and then ask the students to identify the various components in this structure and force them to think about what the various parts of it are and the relationship between them. And I've seen that done in other areas, for example in anatomy, which is a very visual biomedical science, where colleagues provide students with a partially completed diagram of an anatomical structure, and in the course of the lecture they get the students to complete the diagram, and so the student is adding their personal input to the handout, and it gives it more meaning for the student when there's that personal input, I find. So that's, I think, another tip that's worth bearing in mind when it comes to engaging with the students in lectures.